Good morning, everybody. My name is Mark Kavickia. I'm the co-founder and chief digital officer of RC21X. We call ourselves a thermometer for the brain. And what we've done is we've taken traditional neurocognitive and neuromotor tests and we've combined them with human performance game theory developed by our partners at the University of Texas at Arlington into a 12-minute, easy-to-use, low-cost video game that you can use any time of day or night to track your performance. We came up with the idea for RC21X after a very close friend of ours suddenly lost his 17-year-old son due to a misdiagnosed head injury, and we vowed to come up with this easy-to-use solution that allowed people to check their brain health any time of day or night. We are being used currently by healthy individuals that want to track and make sure that their brain health is working normally, and if something's going wrong, they also want to be able to know that. It's also being used by people that are peak performers that need to be at their best because other people's lives depend on that. We are also currently being used by more than 500 former NFL players who have suffered from traumatic brain injuries, and some of them are even showing early signs of CTE, PTSD, Alzheimer's, and dementia. And we're also working with NovaCare and Dreyer Physical Therapy to monitor changes in brain performance for their stroke, concussion, and workers' compensation rehabilitation patients as they go through their care plan. In short, what we are trying to do is have patient objective brain health data added to patient medical records so that you can identify issues earlier, which results in a lower cost of care and improved patient outcomes. Thank you very much.